Okay, my next video goes over opioid safety and management. What I'm going to show you is sort of the bare minimal documentation. Of course, we all hope that you're going above and beyond this, and I'm sure you have a lot of experience in this topic, but I'll show you briefly again the sort of the bare minimum of VA documentation. So all of your patients who are on chronic opioids for non-cancer related pain should have the following three things in place. They should have a pain contract that is signed by you and the patient, documented in the chart. They should have the MassPat or monthly monitoring to make sure that there is no duplicate prescriptions. And they should again have at a bare minimum a once a year urine drug screen. So let me show you how to order those within the chart. So to order a urine drug screen, you'll go under the Orders tab and you'll go to the Laboratory menu. And you'll go here under Primary Care menu. And this is the urine drug screen that you should be ordering. So it's the DAU panel. So you would order this and it would pop up and you would accept the order. And it tells you here what it includes. If you're looking for something exotic beyond these chemicals, then you can order that specifically. Some of my patients who are on tramadol, I will occasionally order a urine tramadol level, and so that you would have to order separately if you so wanted that. So that's how you order the urine drug screen. Uh, if the urine drug screen comes back positive for opiates and you want to confirm that your patient is uh, actually the opiate that the patient has in their urine is the opiate that you're giving to the patient, you could do here, you could use this order, which is the DAU confirmation. So this confirms and it'll actually give you a breakdown of exactly what opiates are in the patient's system. So you would click here on DAU confirmation. Again, let's say you wanted to do the opiates oxy confirmation. So what you need to enter is the time of the collection, the accession number you will be able to find under the actual lab results. So usually what I do is I click on the labs tab and I'll copy that and then paste it here. So you would paste that in and then put myself as the provider, my pager or phone number, and then you would hit accept, and you do not need to call the lab any longer. So this, as long as you sign this order, this will automatically be done, and they will confirm the urine drug screen. Okay, so that's urine drug screening. The next is the opioid contract. So this is a one-time requirement, but if things change and you would like to update it, you are certainly welcome to update your contract with the patient, but it is a one-time mandatory requirement. So you will go to Tools, and then you will go to Clinical Tools, and under clinical tools, you will, excuse me, it's under CPRS. You will go to CPRS tools, and then you will go to IMED consent, and then you'll click on IMED local. And this will bring you to the contract, so it'll take a second to load here. If you have the patient in the room with you, there is a pad. There is a prescription, an electronic prescription pad that you can plug into your laptop or desktop where you can sign and the patient can sign together. If you're doing this remotely, my understanding is due to the pandemic that the patient signature has been waived. So as you can see, that's the first thing that pops up here. It's under primary care consents, basic consent for long-term opioids for pain. And so what you'll do is you can double click on it or you can click begin consent. And this will load the document. Okay, and so it's loading. So does the patient have decision-making capacity? Most of your patients, the answer is yes. The reason for the diagnosis, I'm going to say hip pain. Anatomic location left. Long-term goals, improve function, ability to do ADLs. Let's say they take oxycodone. You'll hit next. You'll put your name as the practitioner, and then you'll hit finish. And what this will compile the document. And so then you can go over this with the patient. So, you certainly don't have to read every sentence to them, but you should highlight for them. It'll go through the brief description of treatment, the idea that opioids are supposed to reduce your pain, allow you to be more active. You go over all obviously, that you're going to monitor them. You reserve the right at any point to, discontinue it if you find evidence that they're getting duplicate prescriptions or misusing, or you just no longer feel comfortable. You go over the alternatives to treatment. So I encourage you to take a look through this document and sort of have your spiel put together of how you'll describe this to the patient. So you'll go over this with the patient, and then you will click the sign button here. And again, if you're in person, there will be a prescription pad that you and the patient will sign. If you are working remote, this will be waived. Once you do the signature, this Save to chart will no longer be grayed out, and so you'll be able to click the Save to chart button. And I'm not going to do that right now, but that is how you do consents. Finally, every month you'll be checking the mass pat to see if the patient make sure that they're not doing using any duplicate prescriptions. So if you go to Tools under the State Prescription Drug Monitoring Program, it gives you a link to the MassPat, and you will enter your email and password and look up the patient. And then the note that you will use every month will be you'll go into New Note, Opioid Controlled Substance Renewal Note. And anybody can do this, so you or any of the nurses on your team. So you'll click here that they have a valid consent. If they're on Narcan, you can click on that. State prescription review. So this basically means that you check the MassPat. This also means you check the MassPat. And renewal of a controlled substance. You found no duplicates. This will bring up the most recent drug screen, and then you'll click off patient has a documented problem that I prescribe it, and they're stable for continued use of it. And then you would hit finish and save this note, and so that is how you document a monthly renewal for any patients you have on chronic narcotics. All right, so just to recap again, each patient who is on chronic narcotics should have a one-time uh, chronic narcotic agreement, which I showed you how to sign. They should have at least, at the bare minimum, a once-a-year urine drug screen, and they should have a monthly state prescription drug monitoring program note placed.